How has Medicare DME coverage evolved over time? Imagine a system that started with just basic hospital care and gradually grew to support millions with the right tools at home. That's how Medicare's coverage of durable medical equipment has changed over the years. When Medicare first launched in 1965, it mainly focused on hospital stays and doctor visits. But soon, it became clear that many patients needed equipment to help them recover or stay independent at home. This led to the inclusion of medical equipment under Medicare Part B, which covers outpatient services and supplies. In the early days, Medicare mainly paid for simple items like wheelchairs, hospital beds, and oxygen tanks. These items had to be durable, meaning they could be used repeatedly, and only needed if a doctor prescribed them. The equipment also had to be used in the home and last at least 3 years. Over time, the list of covered items grew to include more advanced devices like CPAP machines for sleep apnea, walkers, and blood sugar monitors. A big change happened in 1970 to when Medicare expanded eligibility to include people under age 65 who had disabilities or end-stage renal disease. This meant more people could access DME, increasing the demand for coverage. Later, in 1980, the Omnibus Reconciliation Act added more support for home health services, which helped improve access to DME in home care settings. To make coverage clearer, Medicare introduced specific billing codes and guidelines called National Coverage Determinations and Local Coverage Determinations. These rules help define what equipment is covered and under what conditions. In 2006, Medicare added Part D, which mainly covers prescription drugs but also influenced how some DME-like infusion pumps are managed. Today, Medicare covers a wide range of medical equipment, including canes, crutches, hospital beds, oxygen equipment, wheelchairs, and continuous positive airway pressure machines. To qualify, a doctor must prescribe the equipment for use at home, and Medicare may cover either renting or buying the item. Some equipment becomes the property of the beneficiary after a certain number of rental payments. Throughout its history, Medicare's DME coverage has grown from basic support to a structured program that helps millions stay mobile and independent. The program keeps updating to include new types of equipment and to ensure proper use and reimbursement. Beneficiaries and providers must make sure that suppliers are enrolled in Medicare and accept Medicare assignment to get coverage. During emergencies or disasters, Medicare can also adjust its rules to help replace lost or damaged equipment. Overall, the evolution of Medicare DME coverage shows a steady effort to support health and independence at home. The program has expanded its list of covered items, improved guidelines, and adapted to new medical needs over time. This ongoing development helps ensure that people can access the equipment they need to live comfortably and safely.